can you talk a little bit about recommendations for getting back to physical activity after having COVID?
Yeah. So this has been a 2-year journey for us. Those of us that think about this and write guidelines and documents have learned so much over the past 2.5 years. And I think fortunately things have gotten simpler. The bottom line is when you are sick with COVID, when you have your initial symptoms, it's really important to lay off and be as sedentary as you can. It breaks my heart to say this, but there should be no running for a couple of days, right? The body really needs to rest and recover and get through that acute phase. Once the symptoms are gone and you've kind of completed your CDC recommended quarantine, which is now down to 5 days, if you're feeling back to normal, it's perfectly fine to get back into a running cycle. But I think what people need to remember about COVID is that it has shown us to be a very detraining inducing virus. So even if you take 5 days off because of COVID, it's not like taking 5 days off because you go on vacation and you don't run. It's like taking 5 weeks off. So people need to realize they're going to feel sluggish, they're going to feel unfit, and it's going to take time to get that back. But as long as you're just feeling a little tired, you can escalate things over the course of a couple of weeks. The one thing we really encourage people to pay attention to is the presence of, again, this chest pain thing. If you're feeling chest pain when you get back into your training after recovering from COVID, that's a really important thing to pay attention to and not to try to run through. Because in rare cases, COVID can cause heart inflammation, this term you've probably heard in the news, myocarditis, and we don't want people running through that. But that is almost always associated with symptoms during exercise, typically chest pain, and that's what our listeners should be aware to watch out for.
Okay, thank you. And thank you so much for talking about the detraining part. Can you talk about why, why it has that impact?
Yeah, I wish I could, but I don't think we have the answers yet. I've seen it consistently. And in the beginning, I was kind of fond of telling people, just get back into it. You'll be fine. It's just like the common cold, or it's just like influenza. You'll feel better in a couple of days. But that's not been the experience. The experience is that literally every day is like a week. And so it's like coming back from rehabbing an ACL or something like that. It takes weeks to months to feel better again. And that's for those of us that run and push our bodies hard. That's the most concerning thing about COVID to me. It's not ending up in the hospital. It's taking a couple months out of running, which no one wants to do.